Good morning to all of you, and we thank you for joining us this morning. We thank the Center for American Progress for your activism and your leadership on gun violence prevention, and we thank you to every single person who is working on these issues, but for today, especially our nation's top gun violence researchers, because they have joined us today at this press conference. Dr. April Zioli from Michigan State University, Dr. Daniel Webster from the Johns Hopkins Center for Gun Policy and Research, Dr. Garen Winterbutte from the University of California, Davis, Dr. Jeffrey Swanson from Duke University, and Dr. Susan Sorensen from the University of Pennsylvania. Let us be loud and clear. The gun violence which is plaguing our nation is a public health crisis. More than 33,000 people are dying in this country each year from gun violence. That is wrong, that is unacceptable, that is immoral. So we must ask ourselves, why is it happening and what can we do to stop it? When disease and illness bring widespread death, doctors and scientists and public health researchers study the causes so that they can find solutions. And the federal government invests in those efforts. For diabetes, which kills almost 76,000 people in the United States each year, the Centers for Disease Control receives $170 million. For planning and preparedness against the flu, which leads to 57,000 deaths each year, the CDC's budget is more than $187 million. For asthma, which kills more than 3,600 people a year, the CDC's budget is more than $29 million. And for gun violence, which kills more than 33,000 Americans a year, the CDC's budget is $0. Let me say that again. Gun violence, which kills 33,000 Americans a year, has a budget at the Centers for Disease Control of $0. That is unacceptable. That's because for nearly 20 years, from 1996 until 2013, there was a statutory ban on the CDC advocating or promoting gun control. And many interpreted this provision to preclude any research into the causes of gun violence and how to prevent it. But in 2013, President Obama lifted the ban. He issued a presidential memorandum directing the CDC to conduct this critical public health research. And the principal congressional author of the ban, Congressman Jay Dickey from Arkansas, has now disavowed his own amendment, recognizing that it was a mistake and calling for federal gun violence prevention research to move forward. So there is no reason now not to fully fund this critical research agenda and give the CDC the resources that it needs. And that's why I introduce, with the other members of the Senate, who I will be introducing in a minute, the resources that it needs. I introduced the legislation along with Congresswoman Carolyn Maloney, which will fund the CDC to study the causes and prevention of gun violence. Our bill authorizes $10 million a year for the next 6 years. This is the type of gun violence prevention that everyone, regardless of political party or affiliation, should support. No one should be afraid of science. No one should fear the nonpartisan scientific research which this legislation calls for. Not Democrats, not Republicans, not the NRA. Imagine if we had our best minds, the men and women standing behind me here today, studying the reasons for so much gun violence, looking into questions like whether guns can be made safer, questions like whether firearms training are effective, what is the role of the illegal underground firearm market in the epidemic of violence, what are the best ways to prevent suicides, which represent almost 2/3 of all gun fatalities, It is time to take our heads out of the sand on gun violence. It is time for us to confront it with information and open eyes. It is time for us to understand it. If we want to stop this wave of gun violence, we need better information about what is causing it and what can be done to prevent it. So let's give the medical, scientific, and public health community the resources they need. Let's study this scourge, let's understand what's causing it, and then let us put an end to it.